Hi, this is Lori Peterson. I'm the editor of Whole Foods magazine, and I have with me today David Foreman, who is a registered pharmacist who also goes by the name the Herbal Pharmacist. And David serves on the Organic and Natural Health Association Scientific Advisory Board. He's well versed in the healing powers of herbs, vitamins, and other natural supplements. Today, he's going to talk about managing chronic pain naturally. All mics have been muted for the webinar, but you will have the opportunity to ask questions by typing one into the box that's on the right side of your screen. David will answer the questions after completing his presentation. And you should know that the presentation is being recorded and will be put on the WholeFoodsMagazine.com website in the retail content library within a few days. So thank you to Pharmachem Labs for teaming with us to bring you this information. And now I'll turn it over to David. Welcome, David.
Oh, thank you, Lori, for having me. I too want to thank Whole Foods Magazine and Pharmachem for giving me the opportunity to share today. I'd have to say my biggest goal with regards to my natural health career is to really help people achieve the health they may have lost, or to help maintain their health and vitality. So, and today's topic is a big one to be able to share. So I want to thank everybody for taking time out of your day to we'll say tune in. How about that? Since I'm a guy that comes from a pharmacy and then a radio background, I'm going to say thanks for tuning in today. All right, let's move on into the topic of managing chronic pain naturally. Well, it's fun when your slides don't advance. There we go. First, let's talk about what chronic pain is. When I looked up the definition several years ago, I actually had to laugh at I hate to say laugh at it, but it almost seems laughable when you say, it's pain that lasts longer than several months. And this is the part that always made me kind of crack up, because the pain can be continuous or random, mild or severe, debilitating, or just plain annoying. And that's the legit definition of chronic pain. And I was like, wow, they couldn't make up their mind. Was it continuous or random? But actually, when we get into like what those conditions are that people have with chronic pain, it makes a little bit more sense. But I always say, when if you've never seen that before, it's just kind of like, really? Numbers behind it: 100 million Americans are impacted by chronic pain yearly. If you were to add up all the people with diabetes, cancer, and heart disease, add all three of those categories up, the people with chronic pain would be more than all three of those combined. Just to kind of give you an idea. And yet, heart disease is number one killer, cancer number two, diabetes is in the top 5 now, and killing diseases. I feel like they get all the press until something bad happens, and so this is a big deal. To me, this means that somebody probably more than just as a colleague or a friend, family member, loved one, is probably suffering from chronic pain, and you may not even know it. Globally, if you like dealing outside the U.S., we're talking 1.5 billion people. This is a staggering number to me, and statistics are hard to gather. So they usually go in 10-year increments. So the latest isn't out, but from 2010, and everybody hopefully can read these slides. In excess of $600 billion a year in annual cost. I'm not going to get into politics, but as we all know, the healthcare bill is top on people's lists. And by the way, we'll excuse the loud booms that are occurring if you pick them up on my microphone. I live in the Tampa Bay area, Florida, and we're getting a really nice thunderstorm right now, so excuse the loud booms. And then again, if you were to break it down annually per person in the U.S., it's $2,000 per person. Here in the U.S., I know I could definitely handle an extra $2,000 a year, and I'm glad that I'm actually not a current chronic pain sufferer. I said earlier I'd get into some of the conditions that really encompass what chronic pain is. 25 or 27% of the people with chronic pain actually have an issue with back pain. You can see there where it's the leading cause of disability for people under the age of 45. Sometimes people read past the under part and they think it's over. It's actually people under. Headaches and neck pain follow close behind. Headaches, not just headaches, but even including migraine headaches. And earlier when I kind of joked around and I said that, it's kind of weird for chronic pain to be random, but for someone who is a migraine sufferer, they often are not living with a migraine on a daily basis. They may have mild headaches that they can deal with, but then, every several days to every couple of weeks, and in some cases every couple of months, but they're reoccurring enough that it falls under chronic pain. Neck pain, fibromyalgia, sinusitis, joint pain, carpal tunnel. While I'm talking about these, I want to talk about one of the reasons I feel like chronic pain still hasn't been fully addressed here in our country, and why we're kind of getting into this narcotic epidemic, is that oftentimes I feel like modern medicine doesn't dig to the root cause of why we have a particular health challenge. And I'm going to just give everyone a few ideas that you may or may not have thought of with regards to each one of these conditions as to what the root cause may be, because it reflects then on the rest of my PowerPoint. So with back pain, we need to ask a lot of questions like, did you have a traumatic event? Were you in a car wreck? Did you trip and fall? But outside of that, if you look at Chinese medicine usually says for people with lower back problems like sciatic issue that it's either a bowel issue or a bladder issue. And I can't tell you how many people I've helped get rid of lower back pain by figuring out that they actually were having bladder spasms, usually more so in women, especially women that were childbearing. But, is that an issue? Is there a structural issue? Is one leg, a little bit longer than the other? With regards to headaches, more so specifically migraines, but with just generalized headaches, do you have a lot of tension? Is your blood pressure high? Are you having circulatory issues? With migraines specifically, though, other things play into, stress plays into it, perhaps even circulatory problems. One of the biggest areas I've seen to help people with migraines is to look at food allergies and sensitivities. You remove that offending food. I have an ex-wife who had migraines for years, tried so many different modalities, both natural and traditional medicine, and nothing worked. And it wasn't until we figured out she was allergic to wheat, gluten, and eggs, and she removed those, that she hasn't had a migraine since. Neck pain, we could try to go back up to what I talked about. What's the root of the problem? Was there a traumatic event? Are you just super freak stressed out and that you're causing, muscle tension in your neck? Do you have poor posture? Fibromyalgia, there's so many possible, for years, doctors used to say people with fibromyalgia just, they were all head cases. And, what's the root of fibromyalgia? Usually people have some sort of trauma to their nervous system, trauma meaning a traumatic event that affected their mental health. So lots of stress, or a traumatic event that led to lots of stress, or like a car accident that, just freaked somebody out. Sinusitis. Again, what's triggering your sinuses to get inflamed? Are you having allergies? Is it food sensitivities? Is it, is it a paint that you shouldn't have painted your house with? Is it the new car smell? Those kinds of things. Joint pain. Is it arthritis? What type of arthritis is it? Are people consuming too many inflammatory foods? And the list goes on and on. So I just wanted a quick rip through a few ideas of looking at the root of why people have chronic pain, so that we can address those things as well. Because I feel like if we're really going to help someone get rid of their chronic pain, we need to get to the root of why they really have it, instead of just treating it superficially. So on top of that, not like people with chronic pain don't have it bad enough, but then people with chronic pain, that often leads to a lot of other health issues, and modern medicine world, even more prescription drugs. So people that have chronic pain usually have depression. I used to see that in my pharmacy when people with rheumatoid arthritis, the chronic pain led them to being depressed, or or it makes them anxious. This one blew my mind. 42 million people. So you think about it, 100 million people have chronic pain. 42% basically say that they have issues with sleep, and which makes sense if you're in pain. Fatigue. I don't know about you all, if you've ever had an extended period of pain, it just wears you out. It just wears you down. Chronic pain decreases immune function, which means people with chronic pain are more susceptible to getting viral infections, bacterial infections, or even cancer. Because the reason we develop cancer is because the immune system can't keep up with the body's manufacturing of mutant cells. So, and then last but not least, probably not a big issue here in the country, of changes in appetite. It's usually changes in that they just don't want to eat, which, considering 70% of America is overweight, is probably not a bad thing. That's probably a bad joke, but nonetheless, it does, that's one of the things to look at. Let's throw one more thing in here, and I have to actually give a big thanks to Lori, who's running this today for me. She asked me to add this in there, talking about addictions to pain medications. And as a pharmacist, I saw this. I can't tell you how many thousands and thousands of hydrocodone tablets I dispensed, a month in my pharmacy. And that was almost 2 decades ago that I sold it. But here's some statistics I found that I thought would be a little eye-opening. Every day, 60 people die from opioid pain medication overdoses. It's the #1 cause of unintentional death. And I know that's kind of surprising. I think people, whenever they think of drug overdoses and death, they think that people were intentionally doing that. And with regards to opioids and pain, I just want to let you know that it's something that really sneaks up on people. About 1.5 years, 2 years ago, I was doing television segments on the topic of chronic pain, and I was in Chicago. Just a brief story, and I met this woman on my way to the television station, and she's like, "Oh, what are you doing?" And I'm like, "Oh, I'm doing a segment on, I'm not going to mention the station, on chronic pain," and we were talking about the overuse of narcotics, and she's like, "I was addicted to hydrocodone, and I didn't even know it." And I was like, explain that to me. And she actually was a migraine sufferer. Hers were very frequent, and so her doctor prescribed her hydrocodone to take as needed for the pain she was having. And when I met the woman, she had just finished a 30-day rehab program because of addiction to hydrocodone. I can tell you that the majority of people that become addicted to opiates, especially, it sneaks up on them. It's not an intentional thing. And regretfully, they just want relief from their pain, and they're willing to do whatever they can to stop the pain, because of all the things I just mentioned on the previous slide about, the other things they experience with depression, anxiety, and such. And so they take more. And because it's addictive, the body becomes adaptive to it. It's like anybody that's, maybe stopped drinking alcohol for a couple of months, and you go out and have a glass of wine and you're like, wow, I can feel it. Well, but when we're drinking, several glasses of wine a day, you didn't necessarily notice it. Well, the same thing happens with these addictive pain medications, and it sneaks up on them. And eventually, they go from taking 1 every 4 hours to 2 every 4 hours. And then they're just having a bad night. They can't sleep, and they're miserable, and they're in pain, and they take a little bit more. And what they don't realize is that this has a negative effect on respiration, your breathing. And that's why it's an unintentional death. It's, people don't intentionally get addicted to narcotics. The narcotic kind of wraps their arms around the person and gives them a big bear hug and makes them feel warm and fuzzy because they're getting the relief without realizing this. So the next time someone that's addicted, like Brett Favre, I'm pretty sure he didn't get addicted to Vicodins back when he was playing football because he wanted to. It was because he had pain and didn't realize that was going to happen. So, and I'm not picking on Brett Favre, but it's a perfect newsworthy example of someone who accidentally got addicted. This statistic shocks me, and I really don't understand it, but the fact that Americans account for 99% of hydrocodone use and 80% of oxycodone, as a pharmacist, and when I learned the statistic, I still don't understand how are there that many people here in the U.S. that, we're opening up narcotic use to versus other countries don't? I don't know the answer to that. And then recently, in the last few years, the CDC has actually declared opioids or opiate uses as an epidemic. And to help this, the FDA, a little over a year ago, changed the schedule of drugs. So in the prescription world, they have basically in prescription, there's 4 schedules. There's 2, 3, 4, and 5. One is actually illegal addictive narcotics like heroin and cocaine, but they're not prescription drugs, so we're going to throw those out. But most addictive being Schedule 2, next most addictive 3, and so on and so forth until you get to 4 and 5. Hydrocodone, which is the active drug found in Vicodin. I think most people have heard of Vicodin. So when I talk about hydrocodone generically, Vicodin is the most popular brand sold on the market as a trade name. I'm not picking on them particularly. But when a drug is a Schedule 2 drug, the government limits the number of capsules or tablets that can be prescribed by your physician. Usually it's no more than a month supply. And refills need a handwritten or a written signed prescription in order to get it, which means you have to go back to your doctor to get another prescription to get it filled. Whereas anything that's a Schedule 3, 4, or 5, again, those are all addictive, your doctor can write for a month's supply. And state laws vary, but in general speaking, these pharmacy laws vary state to state. And there are federal laws that also set things up. But for a 3, 4, and 5, people can get refills. And dosages could be a little bit slipperier, we'll say. So I did want to address this just because I feel like, it is an epidemic, and it truly is. I'm not going to get into names, but I heard of another accidental overdose this morning, of a celebrity's son. And we really do need to do something about chronic pain so that we can help people perhaps avoid addiction, which, hey, who believes that? A perfect segue to our objectives with regards to natural medicine. And we have to be realists here. Okay. So these are the objectives, and I'm going to cover these actually in my PowerPoint with you all today. Is, first of all, to help reduce the need and or use of prescription and OTC medications. There's nothing in the natural health world that's legal. We'll just leave it that way. That's going to you're not going to be able to necessarily flip a switch immediately and have people go from having their chronic pain to not. So in this case, our objective really is, especially with narcotics, is to get people to be able to reduce their use, and then hopefully eventually eliminate their use, and including OTCs. OTC medications such as ibuprofen and naproxen and even acetaminophen are abused like crazy, because now that they've been put over the counter, people think that because it's over the counter that it's safe. And I'm here to tell you that even my son, when he was a pitcher in baseball in high school, I remember one day watching him take like 5 or 6 ibuprofen tablets. And I'm like, dude, you really should only take 2 or 3 of those at a time. He's like, yeah, he goes, but they're over the counter, so they're safe. And that's, regretfully, that's the mentality of a lot of people. And they don't realize that even the OTC medications, granted, they're not addictive, but they do have a negative effect on kidneys and liver, or just liver function. So, and especially if you're starting to combine those over-the-counter pain relievers with prescription drugs and or other drugs that maybe aren't legal or legal. One of my favorite legal drugs to talk about is alcohol. And if you're combining those things with alcohol, you're setting yourself up for liver issues. So moving on down, other objectives, to use tourniquet supplements. Tourniquet meaning, hey, I'm going to give you some relief. It's not necessarily going to address the root cause, but it's going to ease that burden until we can until you can get healed from your twisted knee, or you can, it may take time to identify what is the root cause. I mentioned earlier, all the possible root causes. Well, not all, but some of the possible root causes, and it takes time to figure those things out. Like I used my ex-wife as an example. You know, it was years of trying all sorts of modalities, medications, natural things until we found that out. So tourniquets are really there to help hopefully provide some relief until we can get to the root and or heal. Make up for nutritional deficiencies that may lead to chronic pain. This one might surprise you when we cover it. Help the body in its fight against inflammation. And I bring this up because if you go back and look at the majority of the conditions that people have that are related to chronic pain, like back pain and neck pain and even headaches, inflammation is one of the major contributing factors or major root problems as to why people have chronic pain. So we're going to look at helping the body in its fight against inflammation. And then I'd be remiss if I didn't take a look at other modalities that may address the causes of a person's chronic pain, you know, and you can see emotional trauma, stress, physical trauma, allergies, sensitivities, and so on. Again, we're not the replacement for any prescribed medication. And this is not the FDA disclaimer cliché thing here. This is the pharmacist and a naturopath telling you all that we are not a replacement for any prescribed medication and virtually all OTCs, and especially when it comes to the narcotics that are used for pain. And then there's often some addictive muscle relaxants that may end up getting used as well. So let's dive into this. I couldn't possibly talk about all the tourniquet supplements. So this is going to get into the supplement part of my chat, which is the quote part of, the supplement of the natural solutions. And I figured one of the best examples is to talk about migraine headaches. There are two herbs. Maybe you haven't heard of them, or maybe you have. The two are feverfew, and the other is butterbur. And these two herbs have shown in clinical trials. So yeah, clinically substantiated to help both with relieving migraines to preventing migraines, helping just with headaches. I remember when I first got into natural medicine, I was asked by my ex-mother-in-law to be an 18th century medicine man in a rural town in Pennsylvania. And these old Dutchmen were coming up to me and telling me how they used to, feverfew actually grew wildly in the fields there. And these Dutchmen were coming up and telling me how they used to pull a few leaves of feverfew off the plant and suck on them when they had a headache. And it's kind of interesting that feverfew was actually one of the first herbs that I was introduced to by someone who actually had used it, as opposed to something I could read about in a book. So, so again, these can be used over time as a prevention for migraines. My experience has been they don't work in everybody. Again, there's so many possible root causes of why people get migraines. But what I've found is that it can decrease frequency, so you're not having as many or as often. It can help with reducing the headaches in general that often will lead up to people having a migraine. Feverfew actually has an effect on inflammation in the joints, so that's kind of cool. But for today, our topic, I think these two are really best used with regards to headaches and migraines. I haven't seen a lot of research with the benefits on joint inflammation, but together, and they're used separately as well. So I have them listed together because to me, they're almost interchangeable with their effectiveness. I would often have people try feverfew for, I'd say 3 months. And if after 3 months, they really weren't getting the effect or realizing the effect, I'd have them try butterbur because they are different plants. And again, for another 3 months, see if they got the results. And if they didn't, then I would say, you know what, they're probably just not for you. The next area I mentioned is nutritional deficiencies. And I actually have two examples here, but the biggest one is vitamin D. And Lori had mentioned that on the scientific advisory board for the Organic Association, and one of the the eye openers for me was they launched a international campaign, and that was their first one actually on nutrients and their real benefits for the body. And the first one they did was on vitamin D. And if anybody's interested, they actually have the campaign still going on, and you can learn more about it. But because I'm on the scientific advisory board, I needed to know more about vitamin D, and I was blown away with the research that's out there showing that people who have low levels, like we're not talking about just low, we're talking about significantly decreased levels of vitamin D in their bloodstream, that they were more prone to and all these conditions. So it's not saying that everybody that's vitamin D deficient is going to have these, but if you have these conditions and you're not quite sure how or why, getting your vitamin D level checked, seeing if you are significantly deficient in vitamin D, and then getting on a vitamin D supplement, it could, I always say that, if you're taking low levels of vitamin D, is it going to treat that condition? No, it's not. If you're been taking low levels of vitamin D, or you've been getting enough sun and your body's making it, although with everybody wearing sunscreen anymore, how do you make vitamin D if you've got yourself all covered up and UV light's not getting into the layers of skin that it needs to? But if you haven't been taking low levels of vitamin D, you can become deficient. And then one of these conditions, that could have been the straw that broke the camel's back, and why you've developed carpal tunnel syndrome. Because there's a lot of people that do repetitive movements, but not everybody has carpal tunnel syndrome. There's a lot of people that have traumatic events that tax their nervous system, but not everybody develops fibromyalgia. Same thing with migraine, same thing with arthritis, chronic back pain. This deficiency could be one of the reasons why that straw that broke the camel's back. So it's something that I think we all need to look into. Testing is a real simple thing to do. And we do know that a great majority of us here in the United States are vitamin D deficient. I'm surprised, personally, my own little testimony. I live in Florida. I'm an avid golfer. I get outside a lot. I try not to wear too much sunscreen because I don't necessarily believe in it. And I did take, I think I was taking maybe 2,000 units of vitamin D3. And I can tell you that when my results came back, I was on the low end of normal. And I was really surprised. And I actually needed to increase my vitamin D intake because I didn't want to be on the low end. I wanted to be right in the middle range of the range. So, but the other one is magnesium. We in the United States are a magnesium deficient society. Magnesium is a catalyst for many physiological processes that go on in the body with regards to pain. Very, very important for muscle relaxation, because a lot of times the muscle stiffness and tightness is why people have their pain. It's also important for neurotransmitter production. We know that if you have an imbalance in neurotransmitters, in the pain world, serotonin is usually looked at. Magnesium deficiency could lead to neurotransmitter deficiencies or imbalances. And so I decided to throw that one in there. So you get a 2-for-1 special here today on my nutritional deficiency slide. Let's get into inflammation. I'm gonna focus in on Celadrin. Primary reason I'm focusing on Celadrin, one is I'm a consumer of it, but probably more so Celadrin. And Pharmachem is the sponsor or initiator of having me do this with WholeFoods magazine, and Celadrin is one of their patented trademark ingredients. So that is why I'm including Celadrin here. And Celadrin we're going to talk about with regards to the body's fight against inflammation. Earlier, I talked about the possible root causes of why people have chronic pain. I mentioned that inflammation is one of the major contributing factors to so many different forms of chronic pain. And so Celadrin actually fits in here. For those of you who have not heard of Celadrin before, that's the trade name of the product. It's actually a patented combination of specially cetylated esterified fatty acids I'll stop real quick and give you the speed version of what we're talking about here. A lot of you probably have heard that omega-3s are really good at helping the body in its fight against inflammation. Well, this is along the lines of the omega-3s, but the fact that they're esterified, it makes this more stable in the presence of oxygen, and it also makes them more readily absorbed. So, but celadrin is not omega-3s. I just want to make that really clear. How does it work? I love when companies do their homework and science on what makes something work. And so I've got the list here for you real quick. Celadrin inhibits inflammation in endothelial cells. So anytime we can help the body in its fight against producing inflammation. Now, I will tell you that inflammation itself is normally a healthy response. I mean, when you cut yourself, as a matter of fact, I cut myself shaving this morning. What happens? Of course you bleed, but then the edges of that cut become red and inflamed. So you have that little red raised area around that cut. That is inflammation. That's a perfect example of what inflammation, and that's your body's healthy response. That inflammation, in this case, produces blood flow. It brings the nutrients that are needed for the healing process to begin. So inflammation, when it's in an acute phase, can be beneficial and a healthy response. It's when inflammation is sustained over a period of time that it becomes unhealthy. So I don't want people to always think that inflammation's bad. Regretfully, just because of our lifestyles here and our diet and things like that, we've now made inflammation, a major contributing factor to a lot of debilitating diseases, and in this case, even chronic pain. Celadrin works directly on white blood cells to help reduce the production of certain immune factors responsible for inflammation. It plays a role in lubricating affected joints. Let me stop here real quick. Why is that so important? So I love analogies, if you can't tell, and I tend to be a dork sometimes with all this stuff. But if we can go back to the Wizard of Oz, and you're out there and you find the Tin Man, right? He can barely move. That's how a lot of people feel. Their joints they're kind of dried out. They're kind of creaky, squeaky. And when we add the lubricant, in this case with the Tin Man, a couple squirts of the oil, it freed them up. And as we age, primarily as we age, the spongy connective tissue and the bursa sac and those joints that have that, they tend to get dried out. And when they get dried out, they become brittle or weak, or they don't provide that protective spongy barrier to make things move more freely. And one of the mechanisms, because of it being a fatty acid, is to help in the lubrication of your joints. So as I always like to say, I hate to say dumbing it down, but for me, I love that approach. It's it can help get rid of creaky joints. How about that? Celadrin also works by inhibiting AA. That's not Alcoholics Anonymous, for anybody that wants to throw that one in there. It's arachidonic acid. Arachidonic acid is an omega-6, so it is an essential fatty acid, but we do know there's a direct correlation now between the overabundance of omega-6s in our diet and the lack of omega-3s. So anything we can do to inhibit arachidonic acid will decrease the inflammatory response in the body. So celadrin has the ability to work like that in inhibiting arachidonic acid, which to me, that's one of the big things, because most Americans have a diet high in omega-6 and arachidonic acid. And then last but not least, celadrin helps alter cell membranes, protecting them from the action of inflammatory immune messengers. Celadrin helps to hydrate cell membranes. So if you have a dried out old balloon and you go to blow it up, it's going to pop. But if you have a brand new, fresh balloon, it's not going to pop, or it's not going to, it's going to be healthy. cell membranes are just like the balloon. So if it's dried out, not hydrated, you're not getting these fatty acids. The cell membrane's not going to be healthy. And then those inflammatory situations can actually penetrate the cell and cause more havoc. So hopefully that made sense to everybody. I'm sure when I get the questions that might come up. So Celadrin, it can be used both orally and topically. So first, this is a study that was published in the Journal of Rheumatology on more specifically osteoarthritis. I hate reading slides, even though I've been kind of doing that. It was a randomized double-blind placebo-controlled trial. Went on for 68 days. People received a little over 1,000 milligrams of Celadrin, and they found that people had significant improvement in knee flexing, pain, discomfort, and being able to walk distances compared to people who took placebo. Again, is this are we talking about replacements for medications right out of the gate? No, we're not. We're talking about helping people to decrease pain so that perhaps they can eventually get rid of it. And if inflammation is one of the triggering factors, it can take a while for the body to down throttle, find out what's really causing the inflammation. In this case, we can do something internally, and again, published in a reputable journal back in 2002. I mentioned it's used topically. This is one of my favorite things of the Foreman household. We don't ever run out of this because we tend to be pretty active. Research was done with pain due to osteoarthritis, showed improvements in range of motion, being able to get up and down from a chair. I don't know about how many of you are out there, but I turned 50 a few years ago. I'm 53 right now. And I don't want to be one of those people that has to use my arms to get out of the chair. I want to be able to just stand and rise normally. And you can see, this is probably one of the things that blows people away the most, is that it works within 20 to 30 minutes. And I have on here, for people with chronic pain, my number one way to suggest this, especially if they have a problem with neck pain, back pain, hip pain, knee pain, wherever it is, anything other than the eyes and the mouth, I actually have people apply this 20 to 30 minutes before they go to bed. And the reason I do that is that it does work usually within 20 to 30 minutes. So if they put it on 20 to 30 minutes before they go to bed, the effect will start to be realized in their body by the time they actually lay down. And they're going to hopefully be able to fall asleep faster because some of that pain has been diminished. And, my experience is the effect is, lasts 4 to 5 hours when you use the topical version. And so and remember how I said earlier that 42 million people have complained that, their chronic pain affects their ability to sleep. So this is one of the things I love to use Celadrin topically. I recommend it all the time for that, to help people hopefully reduce some of the pain so they're able to fall asleep better. And there actually is a clinical trial that was published on the effects on osteoarthritis I mentioned earlier, again, in the Journal of Rheumatology, this time 2004. And you all can read, there were 40 patients. They used the Celadrin cream with no menthol twice daily, morning and night. I've actually suggested being used as needed. Why no menthol? Well, anybody that's ever smelled some of those topical pain relieving gels and creams, there's usually something along the lines of menthol in there. And that can actually also provide an effect, but most people don't like smelling like that. So I think it's kind of cool that they did it this way. Tests were performed at the baseline, basically right, before they started, 30 minutes and then 30 days after treatment. And as I mentioned earlier, range of motion, getting up and down from a chair, step down and extended reach were all measured. It's not often you get 100% compliance from both groups. One of my favorite things in natural medicine is being able to say no side effects. And luckily for us in natural health, there's an awful lot of those things available. And the people also had no use of arthritis drugs, but they did take their medications that were required as in life-saving drugs. And again, improvements were seen in all parameters. And like I said, 20 to 30 minutes is pretty cool. Let's get into the last part of my talk, which is I feel like I'd be completely remiss talking about chronic pain or actually any other health challenge and just stopping at the supplement part of it. One of my favorite sayings that if you've ever heard me before, you're probably bored with hearing me say this, but there's no pill to cure my ill. There's not one pill that's going to do it. And if there was just one pill, it'd be huge, especially in natural medicine. And so for that reason, and then the fact that, especially with our topic today, and I believe with really all health challenges, there are multiple reasons why people may have a particular condition. And so that means there's most likely going to be multiple modalities that may be needed to be used or tried until you get the relief we're looking for. And again, the objective here is to have people, decrease their pain so that they're not dependent on medications, whether they're prescription or OTC, whether they're addictive or not. That's really our objective in natural medicine, because there are other side effects that go with, again, prescription and OTC medication. So with regards to chronic pain, these are pretty well documented to be beneficial. The first one, get out and socialize. They actually found that people who were sufferers of chronic pain, regardless of what type, that just getting out and socializing, they felt like they had a lower, or actually in this case would be a higher threshold for pain. Join a support group. Why? You may learn what work. Somebody else you met had that condition, and you didn't learn about that. You didn't learn about that modality until you talked to Joe at the meeting. So getting out and joining a support group, and sometimes it's just, people always say misery loves company. In this case, maybe your misery will help. You'll at least feel better. You won't be as depressed because you're like, you know what? I'm not the only person suffering from this. Treating the underlying anxiety and depression. Why? A lot of what has to do with chronic pain has to do with the nervous system, and which has to do with neurotransmitter conduction. And anytime we have more anxiety, more depression, that weakens the body, and you're going to even be more susceptible to pain. You're going to be less susceptible to the treatments that are offered to you. So addressing those things, whether it's through counseling, counseling would probably be the best way, in my opinion, to go at it. And then again, the natural health world, there's an awful lot of supplements that work in those two areas as well. Pray or meditate. That spiritual component, it's part of what I preach when I get a chance, is my 4 pillars of health. I believe in order for us to be truly healthy and vital human beings, that we need to have 4 areas that we focus on, not just 1 or 2. So it's diet. Mine are diet, exercise, spirituality, and supplements. And we talked about supplements. Spirituality is part of that. Getting out and exercising, is one, and then spirituality. So pray and meditate. Just it goes a long way, depending on your spiritual walk. And if you don't have one, meditation, call it whatever you want. Other modalities that have shown to be helpful: acupuncture, going to a chiropractor. About a year ago, I actually was suffering from chronic pain. I had pain in my arms, and it was radiating from a couple of discs in my upper back that were a little bit out of alignment. So my chiropractor and I ended up figuring out that my pain in my hands and my arms radiated from my spine, which manipulations weren't enough. Just getting those vertebrae weren't enough, because I actually had muscle spasms that were occurring, that were actually pulling my vertebrae out of alignment. And it wasn't until I ended up getting deep tissue massage, which I don't have on here, but massage is another key thing that could be used. It wasn't until I got massage that I was able to have those muscles relax. And I had knots that were insane. But again, you got to dig to the root of what's causing it. And, just taking pain relievers, whether it's a supplement or not, it wasn't necessarily going to get me where I needed to go. I needed to dig deeper and deeper and deeper until I found the why, what was causing that, and then addressing it. And eventually I have no chronic pain. Increasing your activity. Uh, Lots of research out on exercise. If you're able to do enough of it, produces endorphins, which are your body's own natural little pain fighters. And then last but not least, if you do know you're having a problem with addiction, seek help for that. There are an awful lot of things that we can do. And going back to one of my very first slides, you know, it is a leading cause of unintentional overdose and death, and it is a slippery slope that we get on. You may think that just, you initially started treating your pain with over-the-counter pain relievers, led you going to the doctor. A doctor gave you prescription pain relievers that weren't narcotic, but those didn't quite work as well as you needed to. And then you started getting on the heavier, addictive things. And, then all of a sudden one wasn't good enough, two was, or maybe you overdid it because you were on the pain reliever and you didn't realize you were overdoing it, and that contributed to your health challenge. So truly seek help for addiction. And again, I want to thank the people at WholeFoods Magazine for allowing me to do this today, Pharmachem, and I'll open things up to questions.
Thank you, David. That was fabulous. You can ask questions by typing in the question box on the right panel, and we did get a few questions. Okay. The first question is, are you saying that fish oil is not effective?
No, not at all. Not at all. I apologize if people took it that way. No, actually, omega-3s are, whether it's fish oil or plant sourced, or even algae sourced, which I guess would be plant, are great for helping specifically in that fight against arachidonic acid and its ability to wreak havoc and cause inflammation. So no, I'm not saying that. I still encourage people to take their omega-3s, because in the case of omega-3s, whether it's EPA, DHA, and so on, they also provide other health benefits that something like, in this case, Celadrin would not provide. So no, I'm not saying to stop any of the omega-3s at all. If anything, we need to continue to take more.
I do want to remind everyone that we will be putting this presentation on our website, WholeFoodsMagazine.com, in the retail content library in a few days. We are recording it, and I want to give folks, another chance to ask a question while we have David with us. It's a great opportunity. We've got a little bit of time left, but okay, one question came in. Is Celadrin something that you can turn on and off? Like, can you use it and then stop using it and then start again? Or is it an ongoing thing?
For people with those inflammatory conditions that are chronic, I would not take a break from it necessarily. It's something that you would want to take on a daily basis. Whereas though the topical, on the other hand, is one of those things that I find you can use acutely. And I hate testimonies, but I'm going to give you one anyway. Like when my son was pitching, on the days he pitched, he would put it on his shoulder, afterwards. But on the days he didn't pitch, he didn't really need it. So it wasn't something you had to use on a daily basis. So orally, yeah, definitely you'd want to use it on a daily basis, day after day. And as with most natural health supplements, it could be anywhere from 30 to 90 days before people really realize the benefit orally. And again, for some people like me, I tore a ligament in my knee. So is it going to make my torn ligament be healed and be better right away? And no, it's not. But it helps my body in the fight of inflammation because I have a torn ligament in my knee. So it's not as bad. And I apologize for testimonial stuff. I like to use things as examples. So yeah, orally, it needs to be every day. Topically, you can use it whenever the heck you feel like you need it. It can be used acutely.
Okay. Any more questions before I wrap it up? Okay. Well, thank you so much for your attendance and for your attention. And David, that was just fabulous. Once again,
Thank you.
on behalf of Whole Foods Magazine, I'd like to thank Pharmachem Labs for teaming with us. And I hope you have a great rest of your day. Bye-bye.